We have Jackie Hess, social worker, licensed social worker, and senior director of programs for Family Reach, and it's going to be moderated by survivor Jamie Knox. If you're just now joining us, make sure you're up and running on the Event Mobi app by scanning the QR code on the table tents in front of you. After opening the Event Mobi app, hit the blue agenda button and select the session that you're in. There's a Q&A tab in the top right corner where you can submit questions. After the session, be sure to fill out the survey at the bottom of the session page to earn your raffle ticket. Belinda's handing out tickets at the longevity peer table all weekend long. Our next session touches on something deeply personal and often overwhelming, which is finances. We know money is often a silent weight when living with lung cancer. Again, we have Jackie Hess, Senior Director of Programs from Family Reach, here to make it all easy to understand, and our survivor moderator, Jamie Knox, here to help us with the Q&A at the end of the session. Help me give Jackie a big welcome to the stage.
Good afternoon, everyone, and thank you for joining me for today's session on managing the finances of cancer. I'd like to start by thanking our host, Longevity, for planning this beautiful weekend of community and information and hope. This is my first Hope Summit, and I have already just been blown away by the interactions that I've had with you lovely people, and just getting to know you all and really understanding this community and how strong you all are has been such an honor to see. So thank you all for being here with me. My name is Jackie Hess, and I'm a licensed social worker and the Senior Director of Programs at an organization called Family Reach. By a show of hands, has anybody here heard of Family Reach before? One? Okay, great. And can I put you on the spot and ask how you've heard of us? Okay, great. So she's funded our programs before. So thank you. So for those of you who don't know us, I'm so glad to share a little bit more about our programming. We are a national nonprofit. We're dedicated to removing the financial barriers that stand between a cancer patient and their treatment. At Family Reach, we work with patients across the country, regardless of their age or diagnoses, to help increase access to food, housing, transportation, and utilities. We put our focus into basic needs because we know that when patients can't afford to keep up with their household bills, cancer treatment takes a back seat. Our vision at Family Reach is a world where people do not have to choose between their health and their home. During our time together today, I will share more about Family Reach's new Financial Resource Center, which is how we envision our role in helping to create that world where no one has to choose between health and home. I will also provide tips on how to identify and recruit help through your hospital and through your personal network. And I will guide you through a simple resource search to demonstrate how you and members of your support team can locate programs that are relevant based on where you live and what your needs are. Okay, if you remember nothing else from this presentation today, and if you want to check out from everything else I say, what I really want to drive home is this point here. You are not alone in feeling the financial burden of cancer, and there is nothing to be ashamed of. I'm going to repeat that. There is nothing to be ashamed of if you're struggling financially because of your cancer diagnosis. In my work, I often hear patients say things to me like, oh, if we didn't take that trip to Disney 3 years ago, or if I had been better about saving money, maybe we wouldn't be struggling so bad right now. It's as if we're supposed to anticipate that a cancer diagnosis would come in and wreck our lives. I don't think we need to do a show of hands to know that nobody here planned on getting cancer, and nobody here should have been more prepared for the devastation that it can have on your finances. Until you've been diagnosed, there's just no way to anticipate the many costs that can add up and devastate your finances. Between prescription copays, parking at the hospital, purchasing a wig, or buying special meals, cancer causes a financial strain for many, and maybe even most people. While there is help available, healthcare teams don't always address this side effect of treatment. That means you and your caregiver may need to get comfortable advocating for your own financial needs. So just like we heard in that last session, feel comfortable speaking up. This is another area that you need to get comfortable speaking up with your healthcare team about. It can make some of us embarrassed or uncomfortable talking about money. I know it's been a long taboo. We don't discuss money. But if you are not being asked about it directly by your healthcare team, then you need to take action into your own hands. We at Family Reach have spent the past few years building the Financial Resource Center, which is a digital hub that houses information and resources for cancer patients. Our aim is to reach patients who are both in a financial crisis, so folks who are concerned about their lights being shut off or who have received an eviction notice, as well as trying to reach people before they hit those critical points. And maybe they're newer in their diagnosis and they're trying to learn more about what they can do to prevent some of that financial crisis. We do all of this through our 3 key pillars of support: education, navigation, and financial assistance. You're going to hear me throughout this presentation talk a lot about the Financial Resource Center, and the link to visit the center yourself is in your event Mobi under my speaker bio. You should be able to see it there. So thank you, Jessica, for helping to set that up. If anyone here has ever Googled financial support for cancer patients, you'll know that there are tens, if not hundreds, of thousands of results that pop up. Teasing through that information can be tedious, it can be frustrating, and it's certainly time-consuming. And when you're in the midst of treatment, you may not have the time or the energy to dig through those results to find the program that you're looking for. That's why my first thing to recommend here is that patients build a financial support network or a team of folks who can take on some of the legwork of researching organizations and understanding what programs exist. These folks can become experts on different kinds of supports that are available and can really help reduce some of that administrative burden that actually it takes to apply for a lot of organizations. Your financial support network can and should begin with your medical team. Many hospitals and cancer centers have staff like nurses, social workers, or patient navigators who are available to listen to your financial concerns and help you understand what options may be available to address those concerns. Okay, by a show of hands, I want to see how many of you have worked with a social worker or navigator who asked you about your financial needs. That's great. We have about, I want to say, less than half, which is better than if I had asked this question 5 years ago, right? Providers are more and more getting comfortable asking patients about their finances, but still, you'll see if you didn't raise your hand, you're not alone, and so you may need to take some of these tips and start that conversation yourself. When you work with a social worker or patient navigator, they can help you navigate programs like disability, housing assistance, food assistance, or SNAP. They can also help you locate and apply for cancer-specific programs, which are often available to help with copays, coinsurance, and transportation. And they can get you connected to community-based organizations for support with getting connected to a food pantry, for instance, or an organization that could help enroll you in utility discount programs. Again, for those who didn't raise their hands about being asked about finances, just know that I know it can be really hard to ask for help. Especially when it comes to money, a lot of us do not want to be the one to say, hey, I'm struggling here, I need somebody to help guide me through this. Within our Financial Resource Center, you'll be able to find tip sheets that help you prepare to have that conversation with your medical team. Our tip sheets will cover things like who to bring with you to the conversation and what to bring with you to the conversation. So maybe consider bringing a recorder so that you don't miss out on any details. Or it could also be helpful if you're meeting with a social worker to bring like a list of your current financial assets, because a lot of programs will be income-based. Sample questions you can ask, things like, does the hospital offer discounted parking options? Or can I speak with somebody about getting on a payment plan for my hospital bills? You'll also find a list of questions that you can sort of pull from, right? So you don't have to reinvent the wheel heading into these conversations. We also offer a lot of seasonal tips, so things like heating and cooling your home on a budget, or doing grocery shopping on a budget, and practical information like that. Lastly, within the Financial Resource Center, we offer an interactive and printable expense sheet with spaces to include your regular bills, so things like your car payment and your electric payments, as well as new expenses that you might be encountering, like parking at the hospital, nutritional supplements, and different costs related to your care. I'll pause here. This is just a quote from one of our breast cancer patients who was able to take that tip sheet of how to start the conversation with their provider and have a really successful, meaningful conversation about finances and steps that they could take for relief. So in addition to your medical team, I would also encourage you to lean on your personal network for support. Friends, family members, members of your community, members of your church or your synagogue. Many people are willing to help if you give them a job to do. So take a minute and think about those in your life who, upon hearing that you had lung cancer, said, please just let me know if there's anything I can do to help, right? And a lot of times, patients don't know how to respond to that because we don't know what tasks we can really put off. Sometimes it could be helpful to appoint someone in your life as your financial advocate. This person can help you organize your community to coordinate meal drop-offs during treatment week. You can use services like Meal Train or Lots of Hands to make this a lot easier. They can set up a schedule for friends and family to take turns providing transportation to and from treatment. Or they can host a collection for gas cards to help offset some of your travel expenses. They can also take some of the work of researching organizations off your plate by finding organizations that you might qualify for and checking in with those programs to ensure that they're still available and accepting applications. Even if you don't have someone who you can appoint as your direct financial advocate, or if you do and they want more guidance, I would encourage you to reach out and seek support from cancer nonprofits and programs that can help you navigate the many, many resources that are available. So coming this summer, a little sneak peek here, Family Reach will offer a one-to-one navigation service focused on connecting patients to supports for their basic needs in food, housing, transportation, and utilities. Many of you, I would imagine, have probably already used the Longevity Helpline, which is a tremendous resource that provides financial and emotional support for lung cancer patients and survivors. And Cancer Care also offers a Hope Line to provide support for the practical challenges of a cancer diagnosis. So I'll leave this here if anybody wants to jot these numbers down. My next few slides here will walk you through a demonstration of the Financial Resource Center and one of our key tools within that center. When we created the Financial Resource Center, we did so with the hopes of cutting down on some of the noise that's available online. Again, if you just search on Google for support available for cancer patients or lung cancer patients, it's a tremendous amount of results. Not all of the information you're going to get is accurate or timely, and it's a lot to dig through. So we wanted to simplify this experience so that patients can get resources more quickly that are relevant and accessible to them. So what you'll see here, and hoping that technology is our friend, is a demo of the Financial Resource Center. So what you're looking at is the Family Reach homepage. So you get here by going to familyreach.org, and you're able to access the Resource Center by clicking either the Get Help button at the bottom or this green button on top. And this is our Financial Resource Center. You'll see, again, some of that messaging about how many patients are actually facing this type of financial crisis, and an explanation that the support is within here to help. So the first box that you see, on the right here is our zip code search. I'm gonna walk you through how to use that in a few minutes here. You'll also see the link to our tip sheets, as well as our available financial assistance funds. So by clicking here, you can get to our table of financial assistance funds. This is constantly changing. It's always being updated just based on what programs we have available. I do want to highlight that in order to apply for our financial assistance funds, you need to go through a healthcare provider. So all the more reason to make sure that you're raising your hand in those appointments to get connected to a social worker or somebody who can help you with this application. But you'll see we have different programs available based on diagnosis or things like if you are on a clinical trial or if you are impacted by a disaster such as the California wildfires that we recently saw. Next up, you'll see a demonstration of the zip code search. So I plugged in here the zip code that we're all in together today in Bethesda. And when you select Find Resources, this is what you'll see in a new tab on your browser. There's a lot of resources available within this area to support with basic needs in food, housing, utilities, and transportation. One thing I want to point out is that this page and all of the pages within this platform are able to be translated into dozens of languages by hovering over that section where it says language and selecting from the drop-down menu. But you'll see here, you're able to browse different resources depending on what your most pressing needs are. And you're even able to use that little bar on the top left there to plug in any sort of keywords. So if you're looking for support for something that's not listed here, let's say childcare support or medical bills directly, you could also type that in here and different results will pop up. And in a minute here, it's gonna go to a new screen. So in today's example, I was looking for support with food. So you'll see just by selecting food in this region, there are just over 100 resources available. Not all of those will be applicable to every patient or every person who uses this platform, but it gives us a good place to sort of start to dig through and see, okay, there might be help out there to help fill my fridge. The next thing that you'll see here is by clicking personal filters, you can narrow these results a little bit to try to tailor them more towards something that you might be eligible for. So in this example, I selected that it was a veteran looking for assistance. There wasn't a specific option for lung cancer, but I did select that it was a lung cancer patient as well. I'm sorry, that it was a cancer patient as well. So now that I have some filters in here, I'm gonna start to scroll and just read more information about the programs that are available. I can see sort of this first program is geared towards children, as is the second program. So I'm gonna keep going, and then here I pause on the third program because I think that this looks like something that I might be eligible for in this scenario. I'll click more information to just get more details about each program that's listed within the platform and sort of see, is this gonna help with my needs? Is this gonna help me with my grocery costs, which it looks like, okay, this could be promising. I can learn more about the hours and how to apply. And from here, I have a few different options. I can either create an account and sign in and save my resources, or I can go ahead and share them. Maybe I wanna share them directly with my financial advocate. Maybe I can share them with my social worker, or I can even just send them to myself. I could do that by email or by text. I can apply directly for the program through here, or I can go ahead and check that box and add it to almost like an Amazon shopping cart, right? So I can sort of save this program for later and go ahead and continue to search for additional resources. Okay, this one might be another good option. I don't have the time right now to apply, but I want to make sure I can come back to these. So I'll check this box as well. And then by selecting here, I can go ahead and share a list, right? So I think we could see how this could be helpful if we are having a meeting with our social worker or our patient navigator, specifically in order to address some of our financial concerns. This is a really great way to start that conversation, to say, hey, look, I use this tool. I found these resources that might be helpful to me. Is there any way you could help me look into these? Do you know anything about these resources? What can I do next in order to get the support that I need? I want to pause there for questions, but I know we're going to come back to questions at the end, so I'll keep going forward, and then we can come back to this if we need to. Again, this is just a screenshot of the tool that we just used. We at Family Reach have crafted this program to meet our key areas of support, which is the basic needs, so food, housing, utilities, and transportation. But again, using that search bar right there, if there's anything outside of those areas that you're concerned with, you can type it in there, and odds are something will pop up for you to look into deeper. So that's about it for me today, but as I wrap up, I just want to drive this point home again. Really, you are not alone in feeling the financial burden of cancer. I hear from hundreds of people every day about how they're struggling because of their diagnosis. You're not in it alone, and you don't need to manage it alone either. I want you to lean on your network, your friends, your family, your colleagues, your medical team. So many people would be happy to help support you as you navigate some of these uncharted waters. If you're nervous to bring the conversation up, download the tip sheets in the Financial Resource Center for support, practice what you'll say with your friends, and just remember that none of this is your fault. Feel free to connect with cancer nonprofits like Family Reach or Longevity. There's a ton of information out there, and we're here to help you make sense of it all. And that's it for me. So I'm sure there are questions. I'll turn it over to our survivor moderator to get them up.
Showing that it's on, but testing. All right, there we go. Hey, everybody. So my name is Jamie Knox, and I am a lung cancer survivor. I was diagnosed in December of 2018 with stage 4 ALK-positive lung cancer. Actually happy to say that my scans yesterday came back stable, so thank God for that. Very happy to be here today. So, Jackie, I have a bunch of questions in here for you. So I am going to combine the first two together because they're kind of related. First question says, what should I do if I'm worried about medical debt or getting sent to collections? And is it true that they're not putting your medical bills on your credit report anymore?
Those are great questions. So for the first question, what do you do about medical debt or being concerned about your bills being sent to collections? There are organizations out there that can help specifically with medical debt. $4 is one of them, and so that's DOLLARFOR. That's an organization specifically dedicated to helping patients utilize their hospitals' debt forgiveness programs, right? So a lot of hospitals have these debt forgiveness programs. Most of them are income-based, and so definitely feel free to either reach out to your hospital specifically or to find an organization like $4, which can help. The second part of that question, can you repeat that?
Yeah. Second part of the question is it true that they're not adding medical bills to your credit?
To your credit report.
Credit report.
Okay. I do not want to give any misinformation here. I am definitely not the expert on any sort of policy that has come through with regards to how creditors are looking at medical debt. So I will not answer that question, again, to not get anybody some misinformation. Angela, there are a few other sessions this weekend focused on finances, and so I'm not sure. There may be somebody who's better suited to answer that question. At Family Reach, we're so hyper-focused on the basic needs, so taking care of your home, that this just falls outside of my area of expertise. Yeah, I'm not sure if we have any way to move that question to Sunday. I think the folks at Triage Cancer are brilliant and would be really well suited to answer that question. I'm sorry.
We're going to let her repeat what she said.
Oh, yeah,
Saturday is Cancer and Careers, and Sunday is Triage Cancer and their attorneys.
Okay. All right. So the third question I have here is, many in our community are balancing work and various benefit programs. Are you saying the best resource is our patient navigators?
Yeah, absolutely. Your patient navigators are pretty familiar with the ins and outs of the specific government benefits, which can be standardized nationally, or they can be different depending on what state you live in. So definitely look to your patient navigators, look to your social workers. So with disability, it is, I can't off the top of my head think of like a singular resource that you can turn to for support in navigating that process. It's a behemoth.
We can help with that at Longevity Foundation as well.
Great. Yeah, so I would reach out to the longevity helpline, and we can get, I'm sure you'll see that number throughout the weekend, but it's also listed in the slides here.
And Triage Cancer will be talking about Social Security, disability,
Yep.
Medicare on Sunday.
Thank you.
All right. So the next question is, why don't patients know more about exorbitant facility fees? And I'm actually going to take it one step further and ask if there are any specific questions that we as patients should be asking our providers to get to some of those fees, and just essentially what are some of the ones that you've seen that kind of surprise patients or that maybe come to you guys' plate more often than not?
Yeah. So again, with our programming, we're really focused on, and I'm sorry because I know I have said this a few times now, but really focused on those basic needs. So we're really focused on the core elements of your house, your rent, your mortgage, your transportation, and your utilities. I do think that when you're working with your provider, it's a really powerful question to just ask, what can I expect to pay for my care? And to really dig into that. Again, I think this idea of raising your hand early on to say, I'm concerned about my finances, it sounds like I won't be able to work. I'm not sure how I'm going to be able to afford this. Can we go through this together? Your oncologist might not be the person who's going to sit and walk you through that, but they can definitely get you connected to the person within the hospital who can. So whether that's the social worker or the billing office, there are people who are able to help you answer those questions. So same idea as that last session. If you're asking and you're not being heard or you're not getting the answer that you need, continue to ask.
Okay. Angela, are there any extra resources that maybe Longevity would offer in this field as well, happening this weekend?
Oh, yes, definitely. Again, with the attorneys triage cancer, especially if you're talking about the facility being a hospital, because there's a law now where they have to tell you how much things are going to cost up front. A lot of times it is posted on the website, or you can actually request it, and they have to give it to you because it's the law now. But this is definitely a good question for triage cancer as well on Sunday.
All right. So the next question is, sadly, years into survivorship, the help seems to disappear. Will the social worker or nurse navigator still be open to help us?
Yeah, that is a really real concern, and I definitely understand that completely. A lot of the support is targeted to folks who are in active treatment, family reach services included. There are programs that are specific to survivorship. I know Longevity has a really fantastic survivorship program. And so those resources are out there, but you do have to look to find them. Your social worker, as you continue on through survivorship, should continue to be available to you as they're able. But I also know that sometimes, I can say that, and the experience that you all have might be different from that. It really changes depending on where you're being treated. But there's some really great survivorship groups out there that are really focused specifically on what happens, right? Like what's next, what happens as I enter into survivorship.
Yeah.
Yeah, I wanted to address the facility fee because I went through that myself, which is that if you get your financial aid application into the institution like early on, lots of times if you're a low-income person, they will waive the facility fee for you. So that's one way to do it. As soon as you know you're going to be treated, make sure to get that, get your finances into them so that they know where you are and that you're low income.
Yeah, great. It's
Many times people think they won't be eligible, but that's not true.
Got a mic coming to you.
Yeah, that's not true that they won't be eligible. They take all income levels. They just may say, hey, I'll take 20%
Right.
off. Then it goes 30%, 40%, 50%. But if it's $10,000 and you're getting it to $4,000, that's a deal.
right.
So
Yeah, no, that's such a good point. And I think it really, like this idea of getting organized and being able to really work with your community, work with your friends and family to get a good understanding of what your income is going to look like for the years ahead or the time that you are in treatment is really helpful because so many of the programs, both within the hospital and outside of the hospital system, are income-based. And so really, one thing that I often encourage patients to do is to create a folder that has information about your assets, your income, and anything else that could be relevant as you are looking to apply for programs that are what's called means tested, meaning the determinations are based on your income level.
Okay, got a question in the audience.
I just wanted to make a comment that thank goodness for Longevity because for so many of us, we're not able to, in lung cancer in particular, I don't know about other cancers, we're not able to tell at the beginning of our treatment if we might think, unless we respond to like precision medications, those of us who have mutations, we think we might not be living very long. So we really don't know at the offset what our life is going to look like. Many of us don't realize we'll be able to return to work or at least work part-time. I think that's what's so confusing about facing finances in lung cancer treatment, is that yay, we're alive, and yay, so many of us are doing so well. The unexpected benefit of doing well has created other issues we couldn't have imagined for us, like coordinating with disability, leaving, going back to work. This is what I think is so confusing, at least also for me, who didn't know if I would survive a year at most, and have found myself 4 years and wanting to work at least part-time. So we have this particular set of issues, and just thank goodness for longevity. And I do want to say, I think all of us sitting here, part of why I'm here and I asked that question about benefits is because I want to make sure that when I talk to other people I mentor, we know what to say about these issues, because it's so specific and to our lung cancer community. And thank you for letting me make that comment.
Thank you.
And that may be a good time for you to jump in, Jamie, because I know you know a little bit about what Anna was talking about.
Yeah, I was going to say, just to jump on the piggyback on that, with the fact that we have so much science and research happening, and the fact that a lot of us are living a lot longer than expected, like you said, we're having a lot of these long-term survivor issues that were not an issue before. And so it's like things you have to keep in mind about the long-term cost of your medication, after years and years and years of taking it, the strain on your body after taking that medication for years and years. You may have drained your 401k or your savings, and now you're still here, and you're like, okay, what am I doing at this point? So there's a lot of different things that, we weren't living as long years and years and years ago, and science has given us so much more life that it's like now there's this new set of problems, like you mentioned, where you got to really start thinking about long-term, what am I doing in this life, and how am I making this work? So it's definitely a good thought and a good question that you asked. So on to the next question. We have a lot of elderly and senior citizens are facing healthcare crises, especially in the lung cancer community. They may not be online or be active or have phones or have access to this information. Is there any aspect of Family Reach that's an outreach portion where they're going proactively to some of these communities to reach those folks that may not have direct access online to get to you?
Yeah, that's a great question. And the Financial Resource Center is something that we've been working on for a few years, but it's really new. It's something that we've launched this year. So we do have plans to do some sort of outreach educational training for folks who are less digitally literate, and support with helping to navigate that platform that you just saw, because certainly for folks who haven't been on a computer or don't have access to a computer, that's not a very good option for them. We do also, launching this summer, have that one-to-one navigation program so that folks are able to just pick up the phone and get connected directly to somebody at Family Reach who can basically do the work of that for you, contact the organizations in your community, understand at a basic level, what are the eligibility requirements to get involved in this program, and sort of help get folks connected to those resources. We also do partner with different community-based organizations at Family Reach in order to increase their capacity to be able to serve patients. So we definitely are able to reach patients that way that we otherwise wouldn't be able to reach, either because they're not comfortable talking to their hospital about their finances, or they just haven't found us on their own.
Yeah. And I think adding to that, there's an aspect of lung cancer where it's kind of like an each one, teach one situation, where now that we all know this information and now that we're familiar with Family Reach, we should kind of be helping those folks along. So if you see folks in the community who are struggling, make sure you help connect them, because they may not have access or they may not even know to pick up the phone. So now that you know, take it one step further and help somebody who may not, or just share the info with someone who may not.
I love that.
So we have about 8 minutes left. We have 2 questions left in here. If you want to submit questions in the Event Mobi app, please feel free, or you can raise your hand. It's a small enough venue here that we can probably run the mic to you. But the second to last question is, with the resources and grants available for Family Reach, approximately how long does it take to receive the assistance? Is there any kind of waiting period, or does it vary?
It's a good question. The answer is it does vary. So for our financial assistance, I'm thinking this is talking specifically about our financial assistance program.
Yeah, like
which is-
utilities, groceries that you might need
Yeah.
now.
So again, those applications that we receive, that support does have to come directly from somebody at your healthcare facility. So whether that's your social worker or your nurse or somebody who can advocate on your behalf and submit the application. Our turnaround time is relatively quick. So from the time the application's submitted, typically within that week, it's being reviewed and checks are out the door within 2 to 3 days after that. But I will highlight that, like all nonprofits, our funds are limited. So I want to just manage expectations here because our programs, like so many other programs, can open and close so quickly, which is why we've really started to put a lot of focus in this navigation aspect of our work so that we're able to better address patient needs for those who are not able to receive the direct financial assistance support. So I don't know if I know that was a broader answer than the question that was asked, but the answer is if you're working with a healthcare provider and they're able to submit an application on your behalf, the process is really quick to get the support. And if you're not able to access our financial assistance grants in that way, that we have other supports available to help.
Okay. And the last question here before I take some from the audience is, I've learned that lung cancer has some of the least funding and resources available due to stigma. How can we get involved to raise money to provide more resources for lung cancer patients?
Yeah, it's such a great point and definitely something that we found in our work as well. I think it was 2 years ago that we partnered with Longevity in order to provide support directly to lung cancer patients to help meet this need, because you're absolutely right. We're a pan-cancer organization, which means we work with all different diagnoses. And the reality is sometimes the funding is directed just based on which diseases are most funded. So there could be a lot of funding available for breast cancer patients. We see a lot of resources for breast cancer patients, and certainly less so with lung cancer. So I think the best things that we can do is to just continue to elevate the voice of the lung cancer community and make sure that the folks who are able to donate to these funds know that we're here and that we have financial needs and that we're being overlooked oftentimes, right? So I don't think there's a simple answer, but I do think continuing the advocacy and continuing to elevate the voices of the lung cancer community will be essential to finding funding available to support.
Are you guys being affected at all by any of the budget cuts happening across the nation or any of that stuff going on politically?
Yeah, that's a great question. We, like every nonprofit, are really aware of what's happening right now and keeping our finger on the pulse of the budget cuts and how that is impacting a lot of the organizations that we work with, particularly some of our smaller community-based organizations. We do not, at Family Reach, receive any government funding, so that has not directly impacted our bottom line.
That's very good news.
Yeah.
All right, we have a
Thankful
couple
for
minutes
that.
left. If there are any questions in the audience, we can run the mic over to you. Anything you guys want to ask about Family Reach or financial impact for having lung cancer?
And I just want to say, I know that Family Reach we're so specific, right, on focusing on the household needs and those 4 core areas of support. That's why there's so many wonderful organizations. I really think of us as one piece to the puzzle. I know a lot of the questions that came up today were more focused on things like disability and cancer rights and cancer and work and all of that. And so I'm so grateful that Longevity was able to have us here as sort of piece of the puzzle, knowing that Cancer and Careers is going to be here tomorrow and Triage on Sunday to sort of round out the whole picture. So thank you for your patience and thanks for giving me the chance to be here.
Absolutely. Let's give a hand for Jackie. Thank you.